Very warm welcome to all. Uh, at the outset, I would like to thank Dr. Noshi to invite me here to the 8th Egyptian International Congress. And Professor Noshi is a very well-known entity in all over the world. And I am presenting here today the role of AI in diabetes management. So in the coming few minutes of journey, I will be sharing with you the insights about the AI in diabetes management. So, wait a minute, I will be sharing this screen. Yeah. So, I will be teaching today the important topic that is the role of artificial intelligence in diabetes management. Why? Because transforming the way we monitor, predict, and manage this chronic condition through advanced AI techniques will be the main target of this topic. So, what is diabetes? To begin with, a chronic condition. Diabetes is a chronic metabolic disorder characterized by body's inability to regulate blood sugar levels. So, the insulin imbalance, the body either doesn't produce enough insulin, a hormone that regulates blood sugar, or the cell become resistant to insulin. We all know that there are two types of diabetes. Type 1, where insulin production is too low, and in type 2 diabetes, there is a little decrease in the secretion with insulin resistance. So, symptoms and complications, the diabetes can lead to a range of health issues if left unmanaged, including nerve damage, kidney disease, vision loss, and cardiovascular problems. So, we are here to discuss the role of AI in this chronic condition. So, challenges are there in diabetes management. The fluctuating blood glucose levels, as we see in our clinical practice, the financial burdens, and the emotional toll. So, fluctuating blood glucose levels require constant monitoring and rapid adjustments to diet, exercise, and medication. And the financial burdens, because of the high cost of diabetes medication devices and healthcare, can create a significant financial strain for many patients and their families. The emotional toll is there because the daily demands of diabetes self-care can be mentally and emotionally draining, leading to burnt out, depression, and reduced quality of life. So, role of technology in diabetes care is very, very important nowadays. The innovative technologies are transforming diabetes management, enabling real-time monitoring, personalized treatment, and improved patient outcome. From smart insulin pumps to AI-powered decision support, the digital tools empower individuals to take control of their health and collaborate more effectively with their healthcare providers. Introduction to artificial intelligence. To begin with, we should know what is artificial intelligence. It is a machine learning, natural language processing, computer vision, and autonomous systems. So the foundation of AI is machine learning, where the algorithms are taken and from there they learn from data to make predictions and decisions without explicit programming. Then comes the natural language processing. The AI's ability to understand, interpret, and generate human language, enabling communication and interaction, is natural language processing. Then comes the computer vision, the AI capability to identify and process images, recognizing objects, faces, and scenes, aiding in visual tasks. Then comes the autonomous systems. The AI system is powered that can operate independently, making decisions and taking actions without human control. So this is the very important slide that what is AI? It is machine learning, natural language processing, computer vision, autonomous systems. The AI-based glucose monitoring systems are now available. The AI-powered glucose monitoring systems are revolutionizing the diabetes care by these advanced devices leverage machine learning algorithms to continuously track the blood sugar levels, providing real-time insights and personalized recommendations to help patients better manage their condition. By analyzing patterns in glucose data, the AI-based systems can detect the anomalies, they can predict the trends, and triggered alerts, empowering the patient to make informed decisions and proactively address potential issues. So how it helps? Suppose the last day the patient has taken a heavy meal and his sugar gone up to 300. So the glucometer will give him the alarm that last day you had a heavy meal and you had a very sharp shoot. So the next day the patient will be vigilant that he has not to take so much big meal and he can improve his pattern of variation. Then comes the continuous glucose monitoring and machine learning. The real-time insights, the CGM tracks glucose levels continuously. Pattern recognition, machine learning analyzes CGM data. Predictive analytics forecasts the glucose trends and risk. So CGM with machine learning, it enables powerful predictive analytics for diabetes management. The CGM provides a real-time granular view of glucose levels, while machine learning algorithms analyze patterns to forecast trends and identify the risks like hypoglycemia. This empowers the patient and clinicians to make proactive, personalized decisions. So CGM is also a very good thing which helps the patient to track the events. Now comes the AI-powered insulin delivery system will be available. In this, the advances have been revolutionized that insulin delivery system for people with diabetes will be available, and AI-powered insulin pumps, smart pens can automatically will adjust the insulin dosages based on real-time glucose data. So now they can reduce the burden of manual calculations and injections. So these intelligent devices, they are helping by algorithms to predict insulin needs, account for factors like diet and exercise, and deliver the optimal amount of insulin to maintain healthy blood glucose levels. The predictive analysis for hypoglycemia prevention, which is very, very important thing in diabetes management, the AI-powered predictive analytics can help prevent dangerous hypoglycemic episodes in people with diabetes by CGM, AI-powered CGM. So personalized diabetes management with AI includes adaptive algorithms, predictive modeling, personalized insights, and behavioral nudging. So what is adaptive algorithm? The AI-powered systems can continuously learn and adapt to an individual's unique diabetes profile, adjusting treatment recommendation over time. So it tracks the patient's trend. Predictive modeling, the AI analysis data from multiple sources to predict an individual's future health status and risk of complications and enabling proactive interventions. The personalized insights, the AI generated insights and recommendations are tailored to an individual age, lifestyle, genetics, and other unique factors. The behavioral nudging comes then last, that it is a AI-driven apps and devices can provide personalized guidance and motivation to help individuals to adapt to their health behaviors. The AI-driven lifestyle and behavioral interventions by personalized coaching, there is recommendation for diet, exercise, lifestyle, behavioral insights by identifying the patterns and triggers that influence behavior, enabling more effective interventions. The motivation and engagement is very important by gamification, social support, and personalized feedback. The predictive analytics can provide proactive recommendations to prevent adverse health events or support the health benefits. The telemedicine and remote patient monitoring with AI, there is a remote access in telemedicine. The AI-powered telemedicine platforms, they enable the healthcare providers to monitor patient remotely. The continuous monitoring, the AI-connected wearables and home devices track patient data 24/7 to identify the trends. The predictive analytics, the AI algorithms analyze real-time data to predict and prevent adverse health events. So this is a very important thing. The clinician decision support for diabetes, data-driven insights, physician's assistance, and predictive analytics are the part of this. The AI-powered meal planning and nutritional guidance is another part, which is a helpful thing for management of diabetes. The personalized meal plans will be customized for the patients and the nutritional insights to track their nutrient intake and offer guidance to meet their daily requirements. The virtual nutritional coaching helps a lot by offering them the real-time guidance, feedback, and support to users throughout their day. So the nutrition part is also very well covered. The exercise part is very well covered by AI. The optimizing medication. My dear friends, the compliance and adherence is a very big problem all over the world with the medicines. So this AI-driven compliance, optimizing the medication management, smart dosing algorithms will be there in which the patient data will be taken care to recommend them the optimized dosing based on individual factors. Automatic refill reminders will be given to the patient for improving the adherence. Drug interaction monitoring will be given, and the personalized medication guidance. The AI-driven virtual assistants can provide customized advice on proper medication usage and side effect management. Now, there is very important part, that is the early detection of diabetes complications with AI. Why we are treating the diabetes patient? To prevent the complications. So this is a part which will be taken care by AI to pick up the complications at the early stage. The diabetic retinopathy, the neuropathy, and the nephropathy can be picked up very early stage by AI. So improving adherence and engagement with AI by personalized reminders, gamification, that is, they can produce the game-like elements to encourage patients to track their progress and stay engaged with their care. The virtual coaching help them for emotional support, social support, and predictive analytics will predict their trends and proactively suggest the interventions to improve their adherence. But if AI is used, there will be ethical considerations also. There is a privacy and data leakage problem. Algorithm bias can be there, accountability and liability, and human oversight. So all these ethical problems are also there. Now, barriers and challenges to adaptation of AI are technical complexity. Little bit complexity is there, but like initially we were saying that we don't know how to use Facebook, we don't know how to use WhatsApp, but gradually we all learned it. So like this, the AI will be the part and parcel of our life. So technical complexity will be overcome very soon. The data privacy concern is a thing which have to be addressed. The regulatory hurdles are there, and the physician skepticism to trust the AI. So future trends and innovations in AI for diabetes management are personalized treatment plan, predictive analytics, and autonomous devices. So all these three parameters will be helping us through AI for better management of diabetes. So to take away, key messages are there to conclude: a transformative future, holistic approach, ethical consideration, and transformative potential. So transformative future, the integration of AI in diabetes management promises a transformative future where personalized data-driven care empowers patients to take control of their health. AI will enable a holistic approach seamlessly combining glucose monitoring, medication management, lifestyle intervention, and predictive analytics for comprehensive diabetes care. The ethical considerations will be there, which is crucial to address for data privacy and algorithm bias and the human-machine interface in diabetes management. The last comes the transformative potential. With continuous advancement, the AI-powered diabetes care will become the new standard, revolutionizing how we prevent, manage, and treat this chronic condition. So, my dear friends, the role of AI in diabetes management will be help us to prevent the future complication, to keep the track on the patient diabetes profile, the variations in the glucose profile. They will early pick up the complications like retinopathy, nephropathy, neuropathy. So the holistic approach will be followed with proper compliance by AI. So thanks a lot for your patient hearing. Thanks a lot, Dr. Professor Noshi, for inviting me to this very prestigious conference. Thank you.